Today we're joined by Dr. Maille Devlin, a naturopathic doctor who's deeply passionate about supporting women through every stage of hormonal change, especially the often overlooked transition into perimenopause. Her approach is integrative, compassionate, and truly focused on helping women feel understood, supported, and empowered in their bodies. In this discussion, we're breaking down everything you've ever wondered about perimenopause, what it actually is, the early signs to look out for, what's going on with your hormones, and the many practical ways you can support yourself during this transformative phase of life. So, welcome, Dr. Devlin. Maille, thank you so much for being here today. I'm
Thank
excited
you
to
for
dive in and talk all things peri. Obviously, a conversation that is getting a lot more attention, but needs much more because I think people are still not really understanding this phase of life, which brings a lot of change. So, let's get started.
Awesome. Thanks so much for having me. And yeah, we could talk for 6 hours about this, so I will try to be concise in my answers.
Okay. So let's just start off with the basics. What exactly is perimenopause and how is it different from menopause?
Yeah, I think the language here is really important. So menopause, which we often refer to, is a point in time. So menopause is a checked box. It says, after you've had 12 months with no period, that is menopause, and then you're in postmenopause. So the two chunks, we can kind of think of it as perimenopause and then menopause and then postmenopause. So perimenopause means before. So it's this transition up to that menopausal year. So before perimenopause, you're premenopause. So premenopause is when you're having regular cycles. And then perimenopause is when you start to see this change in your hormones. Because unfortunately, we don't just go from menstruating into not menstruating. There's this period of time, usually on average about 4 years, but it can be up to 10 years for some people, where those hormones are kind of slowly coming down in a chaotic way, not in a very nice, gradual way.
Mhm. So why is it that no one talks about this phase? I mean, I remember being in middle school and talking about puberty, and we never learned about perimenopause. I mean, even the term perimenopause was never even in my vocabulary until I went into pelvic health education. So why do you think that is?
I mean, I think the good thing is, I think this is changing. I think if you talk now to younger women, they understand or they at least have heard the word perimenopause. And when I say, I think that's probably in the last 5 years, we've seen this huge menopause surge, and there's pros and cons to that. But there's
Mhm.
a lot more information now. I think it's mostly generational, and we'll get into some of the symptoms. But when we think about the symptoms of perimenopause, we're talking usually about things like mood changes and anxiety and libido changes and sexual health, vaginal dryness. So I think a lot of these changes people didn't talk about. And the other piece is there's so much overlap with what's happening during midlife outside of hormonal health that some women are going through perimenopause and not realizing it's because of their hormones. So they might not be sleeping, they might have low mood, but they might have a lot of stress in their career. They might be looking after their parents and still their children. There's a lot happening at this time in life. And if you're someone who's going through this time of life, you realize that, it's sometimes hard to figure out, was I feeling bloated because I overate or because of my progesterone, right? So I think it's number one, it is changing. I would say number two, it's uh, a little bit, it used to be a little bit more taboo, and now we're a little bit more open about women's health, sexual health, reproductive health. And then the third thing is, I think some women just didn't know they were in perimenopause, right?
And that's the issue. I mean, because it's such a drastic change. And
Yeah, and
people
it
going,
impacts
and they're always,
everything.
yeah, and they're always questioning, right? Like, could this be perimenopause? And you start to just, because there's so many symptoms involved, you start to take these symptoms and say, oh, is this perimenopause or is this something else entirely? And it's hard for women to actually comprehend what's actually going on. So I think understanding hormones is huge. So maybe you can tell us a little bit about what's actually going on with our hormones in this phase.
Yeah. So if you can kind of picture, go back to, let's say that, grade 9 health class where you can
Mhm.
picture a menstrual cycle, right? So without remembering it perfectly, you can kind of remember there's estrogen comes up and then comes down, progesterone comes up and comes down. So talking about a person who is menstruating regularly without any reproductive disorders or on oral birth control pill, what happens is you have every month hormones rise, they fall, they rise, they fall. And so there's hormonal fluctuations, but they happen in a really typical pattern every month. And then what happens is post menopause, everything is just low, right? So estrogen, progesterone are low. Peri is really confusing because hormones are all over the place. It's chaos, right? So what happens is you you're going from regular ovulation, hormones increasing and then coming back down. But in perimenopause, what happens is you might skip a month where you don't ovulate. And you can not ovulate and still bleed, but you might skip ovulation. And if you don't ovulate, that estrogen gets even higher. And then progesterone tends to get a little bit lower. So then we have this mismatch between really high estrogen, really low progesterone. That's typically what we see early on in perimenopause.
Mhm.
So that usually that results in things like really heavy bleeding. You might feel like your cycle length is changing. You might feel a lot of fatigue, which could be independent of the bleeding, or could be because you're low iron because of the bleeding. We
Mhm.
see worsening PMS symptoms because of this. We see poor sleep with lower progesterone. We see a lot of early awakening, anxiety. So typically, we see a little bit higher estrogen, lower progesterone. And then as we get farther into perimenopause, because we can kind of break this down into early and late, we see estrogen coming down as well. But what's really confusing for women is that one month you can have high estrogen, the next month it can be low. You can have really low progesterone for 3 months, and then we might see a little bit more of it. So there's no specific pattern that everyone follows. Your
Mhm.
estrogen and progesterone are on this slow decline, but they're changing rapidly as you're declining, which
Mhm.
makes it extremely confusing when you either go to a lab or when you're trying to track your symptoms.
Mhm. And at what age are we looking at, symptoms starting at, and how long would you say the transition would typically last for?
So again, everyone's different. Typically, that menopausal year is on average, 51, 52, and perimenopause is about 4 to 5 years before that. So typically 47, 48 into 51, 52. However, if you are 45 plus and you've noticed change in cycles and then some of those common symptoms, you're likely in perimenopause. Perimenopause can also start to happen late 30s. So I think what's really important is not, putting all of these symptoms in the bucket of, okay, perimenopausal, that's for sure it. But if we can't figure out why you're feeling so off and you're 42, we need to be considering perimenopause as well. So
Mhm.
the average is, late 40s, early 50, about 4 or 5 years.
Mhm.
However, early 40s changes can start happening, and some people that's even late 30s.
And what would you say are the earliest, most common signs that people can look out for to know that perimenopause has begun?
So the most common ones I see are disruptions to sleep. That's usually number one. So even if this is what's confusing because you can start to have these more vague symptoms
Mhm.
before you have a change in your cycle. So change in cycle is the most obvious, but you can start to have symptoms before that. So poor sleep, um, early morning waking with a lot of anxiety. So let's say you always struggle to get out of bed at 6 or 7, and now
Mhm.
you're waking up at 5 a.m. every morning and not be able to get back to sleep. That's a very
Mhm.
common one. And that has to do with that lower progesterone level. So, poor sleep, worsening PMS symptoms. So, you will feel the typical perimenopause type symptoms more intensely in that week before your period. So, as you're still cycling, you might start to notice that week before your period, your sleep is off. You might have hot flashes or night sweats just occurring in that PMS week before your period, not all the time. That's typically because everything's dropping and it's dropping to a lower level now.
Right.
You might have heavier periods, and then your periods might start to change as well. And then fatigue, either directly because of hormonal changes or indirectly because of that sleep piece or low iron.
Mhm.
But those are the typical ones early on. And then as you get a little bit later into late perimenopause or post-menopause, that's where we see more of those lower estrogen symptoms. So a lot more of things like dry skin, vaginal dryness, a lot more impact on things like sexual health, joint pain, brain fog, things like that.
Hmm. I hear there's like 55 plus symptoms that can go along with.
Oh, there's hundreds. There's so many. If we look at all of the places we have estrogen receptors in the body, it's crazy. So I think the other piece is there's a huge long list of symptoms, which is why I always recommend people track their symptoms.
Hmm.
And then there's, the very common ones like hot flashes, right? That's a very textbook one that probably growing up we had heard about that as well. That's kind of the only thing most people know about menopause is you have hot flashes, right?
Pretty much. The
Yeah.
baby boomer generation, that's all they talked about were the hot
Yeah,
flashes, for
exactly.
sure. Is there a reliable way to confirm if you're in perimenopause?
Yeah, this is probably one of the most common questions that I get, and it's a frustrating answer for right now. I think the answer will be yes eventually, but for right now, symptom tracking is the best way to do it. And I know it's tedious, and if you are low mood, anxiety, not sleeping, last thing you want to do is add another thing to your plate. But it can be really helpful, bare minimum, to track your cycles.
Mhm.
But then I would take your top, you don't have to track everything, but I would take your top three symptoms and then track those every day. You can just do it in a calendar, notes app on your phone, wherever. But we want to track your symptoms so we can see over time and tracking your cycles. Because if you've always had a 28-day cycle, very regular, and then now those are starting to change, or your flow is starting to change. That gives us a hint. Okay, you have that, plus you're no longer sleeping and you're 48. To me, that's okay, we're in perimenopause. In terms of blood tests, this is a little bit more complicated because if we think back to what I said about what's happening with our hormones, estrogen, progesterone, they're all over the place, right?
Mhm.
So one day at the lab versus another day at the lab, you might get very different levels for these hormones.
Mhm.
So there's some cool technology that's coming out for at-home testing. It's still not something I would take and say 100% you're in perimenopause, but you can look at things like your hormone levels and see and graph. If you could test every single day, if you're not following that typical cycle and you know you had typical cycles before, that might be helpful. So I think new tech and talking about this is really helpful because that means hopefully more funding, which means getting more resources for women. But I do think we will have a way to at home track a little bit better our hormone levels and see. For right now, though, symptom tracking is the best.
Mhm.
Once you're actually in like your post-menopause and you haven't had a period for 12 months, or even if it's 6 months, what you will start to see is your FSH, so follicle stimulating hormone. If you did that as well as your estradiol, your estrogen, you would typically see FSH would be higher and estrogen would be lower. That would give us a very good indication if paired with symptoms and change in cycle that you're likely, you know, perimenopause entering into that menopausal year. But
Mhm.
if you're, 44 and you're still cycling, then it's really hard to look at that through blood tests.
Mhm. So, what would you say? How do we work with these symptoms? How do we manage these symptoms? How do we, with, having so many and having to continue working and family life and all that, how do we juggle everything? What are the best ways to do this?
Yeah, and it's different for everyone. For example, if someone is not exercising and, drinking wine every night, that's where I would
Mhm.
start. If someone's doing all of those things, but they're not allowing themselves to rest enough, then that's where I'd start. So it really is individual. But what I would say is it's kind of like fertility. The things that, if you're looking to improve your fertility, we just want a healthier version of you. Same with perimenopause. The healthier you go into perimenopause, typically the easier that transition is. There are obvious things we want to take out from a lifestyle perspective. Unfortunately, red wine is one of them. Like alcohol is a very well-known trigger. If you are symptomatic and you have hot flashes and night sweats, wine will be one of the biggest triggers for most people. So
Mhm.
things like taking that out. For sleep, for example,
Mhm.
even though sleep disruption is caused by the low progesterone and that change in your hormones,
Mhm.
going back to sleep hygiene and the typical things we know help with sleep, things like limiting caffeine, that can be helpful. Even if you were a person before and you could tolerate caffeine at a coffee at, 5 p.m., now taking that out might be helpful. So going back to the basics are really helpful. Nutrition is a big one, especially because of what's happening with body composition throughout this time. So we've mostly been talking symptoms and what someone experiences, but in terms of the health changes, not to add more to this, but there's health changes too, right? So we know that your bone mineral density decreases, your muscle mass decreases. So we also want to make sure we have enough calcium, magnesium, vitamin D, protein. And so we also want to make sure we're eating, more Mediterranean style diet, less processed foods, get enough protein, fiber. So, sleep support, nutrition support, exercise is huge here. I think sleep and exercise are very tricky because good sleep and a good amount of exercise are helpful. Those are two things women have a lot of barriers with during this time. If you're exhausted and not sleeping and stressed, it's hard to get up in the morning and go to the gym. So I think working with someone who can help you complete those goals in a way that makes sense for you is helpful. And then the last thing I'll say about lifestyle is going back to the tracking piece. If you are, let's say you're experiencing poor sleep, hot flashes, and low mood, if you could track those along with your cycle, you might notice, okay, in my luteal phase, so post ovulation until my period, I have a lot more hot flashes. It might mean, okay, you know what, I'm going to meet up with my girlfriends and I don't want to give up wine. I'm going to try and schedule that in the first half of my cycle. So strategizing can be helpful there, and looking at, finding what triggers your symptoms and then eliminating those, or at least being strategic about it.
Mhm.
And then there's lots of different supplements that can be helpful. I would say starting with the nutrient piece is important. So, like I just said, calcium, vitamin D, magnesium, making sure you're getting enough of those nutrients, ideally from your food, but especially if you live in Canada in the winter, you're probably going to need a little bit more vitamin D. So, when I talked about, blood work, from a hormone perspective in perimenopause, not that helpful, but from a nutrient perspective can be really helpful.
Mhm.
Iron's another huge one. Low iron levels are very common in this population because you're sometimes bleeding more often, but also typically bleeding more heavily. So you're losing more blood per month. So we typically see low iron. And what's difficult about this is low iron has a lot of similar symptoms to perimenopause. So low iron can impact your mood, it can impact your sleep, cause hair loss, fatigue, right? So if you are anemic and you have low iron a lot, and you're also in perimenopause, you're going to feel a lot worse. So sometimes adding in something like an iron supplement, if you know you're low in it, can be really helpful. And that might be all you need to get to the gym to then help with things like hot flashes.
Mhm.
So yeah, calcium, magnesium, vitamin D, iron. Soy can be helpful. So soy isoflavones, you can take them in a supplement format. You can also do something like a soy protein can be really helpful. Swapping things like an oat milk for a soy milk, you get a little bit more protein, plus you get a little bit more of the soy isoflavones, which can be helpful for things like night sweats and hot flashes. Omega 3s can be helpful for things like mood, cognition, and then later on, they can help with things like dry skin. So the nutrient piece is really important. Creatine is another one that can be helpful from a body composition standpoint, so helping with the muscle mass piece, but also new research also looking at the impacts on brain health and cognition and actually lower mood in perimenopausal women. So that can be helpful as well. And
Mhm.
then we have we have herbs as well. So those pieces are more nutrition related and kind of supplementing nutrition. And then we can think about herbs kind of like we would a pharmaceutical, right? We're adding these in. It's not something we're low in, but we're adding things in to help you feel better, to help manage symptoms. So they're not necessarily making you healthier, but they're managing. So, for example, early on in perimenopause, Vitex or Chaste Tree can be really helpful for things like really intense PMS symptoms. So, like I said, that PMS tends to get worse, and you might feel like your mood. It might not be low mood. It might be things like irritability or rage. A lot of women have in that perimenopause time. And so you might feel like, why am I so irritated with everyone in my family? And so that's where something like Vitex can be helpful. And taking that, some people cycle it, or you can just take it through the whole month. That can be helpful. Um, Herbs like sage can be helpful if you have really bad hot flashes. That tends to be a little bit in that later perimenopause where you get a lot more hot flashes. Sage can be helpful. Um, there's formulas like Ester 100 that have basically a combination of herbs that have phytochemicals, which are more anti-inflammatory, which can be helpful for things like reducing down hot flashes, helping with sleep, fatigue. And then we have things like ashwagandha. Ashwagandha is a great herb. It's not necessarily just for perimenopause. It's very helpful for things like sleep and stress. So let's say you can't sleep and then you have this anxiety, but you also have very real life stress. Something like ashwagandha might be helpful short term to help modulate those stress levels so you can deal with stress a little bit better, and then helps with that, nighttime cortisol spike that sometimes happens at 3 a.m. and you have got your to-do lists and everything.
Mhm.
Um, and so, I mean, I could keep going. There's a million different things people can do, but I would say starting with tracking all your symptoms, looking at, okay, every time I have alcohol or, have a certain action, I have hot flashes and night sweats. Okay, let's start there. Take out those specific triggers. And I think realizing that things that weren't triggers before may be triggers now, and that's okay. And that it's not going to last forever, right? So removing things that you know make symptoms worse, then add in the healthy lifestyle things we all know we should be doing. Things like exercising, especially resistance training, and then making sure you're getting support for your sleep. And if you really can't sleep, making sure you talk to someone about that. Because if you're not sleeping, you're going to feel awful. And then nutrition is another big one, and then adding in those supplements as needed.
Ask you specifically, but also were black cohosh and evening primrose oil, because those are mentioned to be beneficial. I'm just curious as to what your take is on those two and in combination with one another.
Yes. So yeah, no, it's a great question. Those are very common ones. So I would say, so black cohosh is a little bit more helpful later on, because black cohosh helps a little bit with the lower estrogen type symptoms. So I would say if someone is entering perimenopause, usually I would support more through something like Vitex or ashwagandha. And then let's say you haven't had your period for 6 months, you've got bad hot flashes, vaginal dryness, that's where something like black cohosh can be helpful. Absolutely. Evening primrose oil, which is a great source of GLA. Basically, it's in these healthy fats. Sometimes you can see that as a combination. You get them with your omegas as well.
Mhm.
And that can be helpful for the PMS symptoms. So you're right in that that one can be used in perimenopause as well, is specifically if you have a lot of breast tenderness. And most people who have, especially if you have fibrocystic breasts and you notice before your period you get a lot of pain, breast pain, that's where that can be really helpful. And so they can be used together. And so I would say typically the evening primrose oil, the GLA would be a little bit more peri, and then the black cohosh would be more post.
Okay.
And then the other piece is making sure you're getting enough of good fats from your diet as well, right? So making sure you're having olive oil and fatty fish as long as you eat fish. That's where and nuts and seeds, right? So that's where we can get those healthy fats, which can be really helpful for our hormones.
Mhm.
And then if you find that, let's say you start on evening primrose oil and you feel so much better, I would say, okay, let's look at your nutrition as well to make sure you're getting enough of those healthy fats.
Mhm. And then let's talk a little bit about HRT.
Yeah,
So,
of course. That's where I was just going to go next. And I mean, that could be a
uh,
whole other conversation.
yeah.
Um, I love HRT. I mean, and just for people, HRT is hormone replacement therapy. Sometimes it's also now called menopause hormone therapy. And basically, it's what happens is you have lower hormones post menopause, and so the idea is we add them back in. Now you can add hormones in and this is a little bit different than what people used to think. We used to wait until someone was really low and we kind of add them back in. But you
Mm,
can actually use estrogen and progesterone during that perimenopause phase as well to help. And so typically when we see, let's say someone's in perimenopause and they don't have vaginal dryness and they don't have hot flashes, they're mostly just have like that anxiety and sleep issue. If we can't, work on this from a lifestyle perspective, sometimes if we add in a little bit of progesterone there, and you can even cycle that if you're still having regular cycles, you can add in a little bit of progesterone, and sometimes that's really life-changing for people so that they can kind of go about life. And if that's the only symptom, you stay on that. And then as things progress, you might add in the estrogen a little bit later. Um, there's tons of different forms of hormones, and I think that's what gets really complicated for people because you can take an oral birth control pill, you can use an IUD to help reduce down symptoms, you can use topical preparation, so you can use a patch, you can use a gel. And so you
mhm,
want to make sure if you're looking at adding in hormones, you're working with someone who knows about the different combinations and also who knows about your specific health history, because menopause hormone therapy is fantastic and it's really life-changing for some people, but it's not for everyone. And I think that's the other piece. And this always happens, right? So there was, no one was really prescribing hormones. We said, okay, in general, that's bad, causes cancer. And then, people started saying, no, everyone prescribes, everyone should get hormones. And so, especially if you're on Instagram or TikTok or Facebook, and you see one of those opinions that either hormones are bad for everyone or you don't necessarily need hormones. And then everyone, as soon as you hit, 48 should go on hormones.
mhm,
Neither of those are true. Like everything, we need an individualized approach. They can be fantastic and life-changing for some people, and for other people, they're not needed. So I think it comes down to, do you have severe symptoms and what dose are we using and who's checking in on things?
mhm.
And making sure you have a provider who, if they're prescribing hormones, kind of knows what to follow up with, right? And making sure that they know what they're doing and that you are aware of what you should be looking for is the other piece too, right? So I always tell people if we're starting them on hormones, we do something called menopause rating scale. Look at all your symptoms, get some sort of objective measurement, start on your hormones, and then redo it. So see, am I improving on this? Because if you've ever, added in hormones, there's some dose adjustments that need to happen. And so I think it's not necessarily yes or no, it's which type, which dose, and having those conversations and making sure you have a practitioner who can have those conversations with you.
Mhm, mhm. Yeah, it's a huge topic, and because there's been some controversy in the past, people are weary. But it has been shown that it is now safe, and I believe the black box label has been removed in the States. So we're obviously
Yeah,
moving in the right
it's
direction and seeing that HRT can be a very beneficial approach. Um,
totally.
going
Yeah.
through this and important, right? Because I think it was really hard for women who were told it was causing all these issues like cancer and cardiovascular disease, and then they were just sort of stuck with no solution. So this is very promising that we can now, and hearing from a naturopath as well, that your pro HRT is always a good thing. So
Yeah. Yeah,
yeah,
I
and then the
prescribe
other
hormones
thing
in my practice. It's yeah.
the other thing I did want to bring up too is a little bit about genitourinary syndrome of menopause. I think this
Mhm.
is also sort of a topic that doesn't get enough attention. And a lot of women I'm seeing are struggling with recurrent UTIs, especially in the postmenopausal period. Why is this happening so often for these women, and how can they manage that?
Absolutely. It is, yeah, it's one of the and it's something that people don't necessarily kind of pair with menopause until
They
they realize,
don't.
I've had
Mhm.
3 UTIs and, I wasn't wearing a wet bathing suit and I did all the things and they have their little list that they've, had in their
Mhm.
head for 30 years about, okay, all the things they're doing. But that's because of and exactly what you said, it's post-menopause typically, or kind of closer to that menopausal year where estrogen is not necessarily high, it's kind of come down a little bit. And so now estrogen being lower can cause that vaginal dryness, and then that increases risk for the urinary tract infection. And also, So UTIs and also things like yeast infections. And so it it depends. What I would say is, treating that actual the urinary tract infection, there's fantastic, there's supplements that can be helpful, like D-mannose and cranberry and things like that. But if you are getting recurring UTIs, number one, you want to go on antibiotics when you need them, right? So if your UTIs, lasted a few days, you see any blood, anything like that, antibiotics treat the actual, it still is a bacterial infection.
Mhm.
So what you'll do is you'll have your urine looked at. If there's bacteria in there, then you'll get the antibiotic. Take the antibiotic, clear the infection. But in your tracking, in your little perimenopause journal, add that in there. If that's happening consistently, it's probably more due to vaginal dryness, and that's where something like vaginal estrogen can be really helpful. And vaginal estrogen is different than systemically absorbed as estrogen, like a patch or a pill.
Mhm.
So, vaginal estrogen is safe for most people. So that might be your solution is either, systemic menopause hormone therapy, but even if you can't, vaginal estrogen is typically very helpful for that.
That's good to know. And then, like you said, also preventative. So taking things like D-mannose and cranberry packs and can all be very helpful in preventing infections before they
Absolutely.
happen. Um, so let's end off with just one thing you wish every woman knew going into perimenopause. What would you say to them?
If I had one thing, I would say it's a phase and it will be over. Because I think especially symptoms like cognitive decline, I think is a really scary one where people are like, I can't remember where I put the keys, or I can't remember this person's name. And this brain fog symptom is really scary midlife, especially for people who have family history of Alzheimer's disease or dementia. And so that's one example, or things like low libido, and you feel like, is this forever? Is this my relationship? And so I think remembering in the back of your mind that, this is a phase and it will be over. These symptoms do peak and then they do come down. For
Hmm.
some women, unfortunately, that can be a long time, but it does end. Um, and I would say, I know it's my one thing, but I have one other thing that I think
That's okay.
with all the conversation online, I think that it's important to know that, just because, it's natural doesn't mean you have to suffer, right? There's other conditions that we go through that are natural, and there are things that we add in to help us. So just because it's natural and this natural progression doesn't mean that you have to go through it without any intervention. But the flip side is also true that with all of this information, I want to be careful we don't go too far to the other side where we say, we start treating menopause like a disease. It's not a disease, right? So I think we just need to find a little bit of balance between the two. And so, let's add intervention to help women feel better. And so they can show up at work and be there for their families and enjoy life more. But if you don't have a lot of symptoms, we also don't want to, add in too many things here and make this feel like, a big disease that we need to kind of treat, or women during this menopausal time can't do the same things they used to do. So I think we want to keep with the, you know, empowering narrative and rather than saying, oh, you're perimenopausal, you're menopausal, you can't do this. That's what we have to be careful about, I would say. So, but yeah, one thing is it will be over. It's not forever.
Yeah, I think it's sad that it's had such a negative connotation and I mean understandably so, right? I mean there's so many unpleasant symptoms, mental, physical. It just seems like, everyone's going in just dreading it, right? So the one positive thing I think we can take out of it is we now have treatments that can be quite effective, and we can openly talk about it and tell
Yeah,
people how we feel. And I think that the acceptance piece and lessening the stigma should really take us to a better place and make us feel more comfortable in the phase, or this
absolutely.
transition. And maybe there will be some positive that comes out of it in the future. We'll see, right? But
Absolutely.
let's hope. And thank you so much for coming and on and talking about this important topic. I mean, clearly people need to know what's going on, and I think with your holistic approach and then bringing HRT in, it's great that to see that you're taking on HRT and then also looking at the benefits of the supplements and the nutrition and the lifestyle. So clearly, it's a multifaceted approach that we need to take to get through perimenopause. And we'll end there, and hopefully we talk again very soon. Thank you, Dr. Devlin.
Awesome. Thanks for having me.